How can we define the palliative care? If the examiner asked you what is mean by palliative care, and a lot of candidates already this question faced it in the exam, and one told me treat the pain, one treat means the symptoms, but you have to define. You are a good doctor, so that you have to know the definition well. The World Health Organization defines palliative care as an palliative care. It is approach that improves the quality of life of patients and their family facing the problem associated with life-threatening illness. So that we have to define, yes, palliative care means improve the quality of life of patients and their family facing problem associated with life-threatening illness. Through what? Through the prevention and relief of suffering by means of the early identification and assessment and treatment of pain and other problems like physical, psychological, and spiritual. Again, if the examiner asked you what is meaning by palliative care, you have to define for him. Palliative care means improve the quality of life of the patient and the families, so that it is not only for patient. So the palliative care, we have two tasks, one for the family and one for the patient. Okay? And to early identification of physical and psychological and spiritual need. This in short sentence. Palliative care, it is different than traditional care in that palliative care, it is typically doesn't rely heavily on invasive test or procedure or other diagnostic method that are aimed at the finding the cause or specific medical treatment. So that palliative care, it is not rely on the invasive process or treatment. It is rely on the consequence of the disease. Again, because we are excellent, so that we have to repeat again. I think you can take this record in a flash memory and put it in your card and listen it every now and then. I think it is good. You will sleep well. So that what is meaning by palliative care? Palliative care, it is improve the quality of life of patient and their family and the early identification of the patient and the family needs. That is good. It is very good now. So that forget what I said. It is improve the quality of patient and the family and identify their needs. One statement. What is the needs? It is physical, psychological, and spiritual needs. Dr. Khatib will take a snapshot for this sentence. Again, I will repeat it again. Improve the quality of life for the patient and the family and the early identification of physical and psychological and spiritual need. That is the definition of the palliative care. Palliative care, it relies on, or it is palliative care, it's specific for the consequence of the disease, not the cause or the treatment.